Hi, everyone. Welcome back to the Career Boost series of the Medical Portfolio podcast. Prepare to elevate your professional journey with insights, strategies, and pearls of wisdom from our esteemed guests. I am thrilled to introduce our special guest today, Dr. Mirvat Alasnag. Mirvat is the first woman interventional cardiologist in the Gulf region, and she's currently the director of the catheterization laboratory at King Fahd Armed Forces Hospital in Saudi Arabia. She is very active in the American and European Societies of Cardiology and has been involved in clinical research focusing on interventional cardiology. With a remarkable commitment to advancing cardiovascular health, Mirvat brings a wealth of wisdom and experience to our discussion. Mirvat, it's a pleasure to have you with us today.
Well, thank you, Ricardo, for the invitation and this wonderful introduction. Thank you.
Can you provide a brief snapshot of your career journey in about a minute?
Wow. Well, really, I feel I'm a product of the global healthcare system. I trained in different countries and different systems and collaborated with colleagues around the globe, which really allows me to gain a wider perspective on cardiovascular diseases and therapies. Part of my training was in the United Arab Emirates, Saudi Arabia, United States, and I'm finally settled and practicing in Saudi Arabia at this time.
That's perfect. And who were your guiding lights and sources of inspiration in your medical career?
Well, I was fortunate to have many over the years, men and women, who have impacted my decision-making abilities, some who helped me develop my skills as an operator in the cath lab, and many who have really lifted me to the international arena and opened doors for me to become a member and an active member in committees in the American College of Cardiology, in the European Society of Cardiology, and so on and so forth. I don't think I can start listing them because I really do think I've been exceptionally fortunate in that sense.
And could you share with us some of the significant hurdles you have faced in your career and how you navigate through them?
Well, I think being physically small, petite, and young in a field like interventional cardiology has been a challenge when I first started and when I first graduated and started practicing. I think patients and their families often expect a gray-haired man, and the trust is automatic when a man who's, older age and commanding in the way they speak walks into the room to consent them for a coronary or structural procedure. And I think I overcame it by really just persevering, but opening lines of communication with my patients. So I quickly noticed that when I hold family meetings and I explain the diagrams and show them the angiograms, sometimes pre and post procedure, and I address really any of the queries and questions that they have about the procedure itself, complications, expectations. And once they start seeing that I have the information and the details and I can convey it to them, they start to warm up and gain trust. And soon, they start to realize, oh, really, she knows what she's talking about. And really, over a course of a few years, my patients became my best advocates and my best proponents. And now they refer their neighbors and family members and friends to me. And so that's kind of really was the biggest hurdle and how I came over it.
And reflecting on your journey until now, what do you wish you had known before embarking on your cardiology career?
That you're really not on your own, that it is a community of mentors and mentees and colleagues. And so we're really a team, it's a team sport. And as long as you have around you a team of physicians, clinicians, operators, nurses, technicians, etc., whom you established great rapport and friendship with, they have your back, you have their back, and eventually the successes are assigned to the team along with the failures. And so you quickly realize that that's how you grow as a team.
In your perspective, what stands out as the most crucial quality for a leader in the medical field?
I think the most important quality of a leader is to lead from behind, really. Most level-headed mentees and team members will appreciate a leader that, pushes you from behind, gives you the stage, gives you the opportunity, but still guides you. And I think it is important that mentees also understand that it is reciprocal. You need to be valuable. You need to trust your mentor. You need to trust the leader who's trying to put you in the spotlight, give you opportunities, but you also need to deliver, right? Because it's hard to stick your neck out for folks who don't really deliver, don't meet deadlines, and so on. So I think to me, it's leading from behind is probably the most important quality.
That's really interesting. And now shifting gears to the critical thinking focus here of the podcast, tell us about how you cultivate and apply critical thinking skills in your daily work.
This is actually an acquired skill that I learned by associating with primary investigators of trials and joining editorial boards. It's tremendous value because it allows you to also introspect and grow. You start to learn to critically appraise yourself and your work and what you do. And that's how you start to grow. I think if you don't pause and look at what you're doing and where you're heading and what you've done wrong, it's difficult to grow and build on it. And I think that's really what's worked for me in the last few years.
You mentioned a few minutes ago, like gender expectations, and our last guest was Marta Gulati from the United States. And we've discussed, of course, the women in cardiology movement addressing gender disparities. You have been also very active in this topic. And my question is, do you believe these disparities still persist in medicine, especially in cardiology? And have you encountered them firsthand?
Disparities do exist, and I think it would be foolish to be dismissive of that. I think we see them not just for physicians, clinicians, cardiologists, but you see them at the patient level as well. For example, we know that women are less likely to receive bystander CPR and are less likely to be offered revascularization, be it percutaneous or surgical. And so there have been consistent and numerous registries from around the globe that have shown that have shown women are offered guideline-directed medical therapy less frequently, CPR less frequently, and so on. So I think it is incumbent upon us as a medical community, one, to acknowledge that it exists, and two, to educate and conduct research that is dedicated to women's health and to encourage the community to build on it. And I use the example of MINOCA and SCAD. MINOCA and SCAD is not restricted to women, but it was first addressed in women. And once we started to understand the disease process, understand the role of imaging and so on, SCAD is now our understanding, the registries are growing and so on, and it's inclusive of all patients, whether men or women.
And with all of that, balancing work and personal life can be challenging. What strategies have you found effective in maintaining this balance?
Trial and error, made many mistakes that I had to learn from, but I ultimately learned that I don't multitask. I recognized relatively early that multitasking isn't time efficient really, and it's actually a distraction. So I'm goal oriented. I set deadlines when it comes to work. So I try not to spill administrative responsibilities into my clinical schedule. But I'm also like 100% committed when I'm in the cath lab. I'm not focusing on administrative stuff. But it's also learned that family time is precious. And I no longer take calls, phone calls, random calls when I'm with family and on occasions. I used to do that, and it causes burnout and a distraction. So I think, when I'm with family, I try to commit to the family trip that we're on, switch off emails, switch off my WhatsApps, and so on. And so I think clear demarcation is probably safer and healthier.
This last answer of yourself, it's part of the answer for my next question. But do you have any words of wisdom for young professionals aspiring to thrive in cardiovascular medicine?
I think what I would say is it's okay to make mistakes. So you're bound to make mistakes. Try to learn from other people's mistakes, but you're bound to make your own mistakes. But learn from them. So don't insist on the road that you're taking if you notice that it's not working for you or that it's burning you out or what have you. And pause to gather your ideas, re-energize and then move on. I think it would be probably unhealthy to just continue just because you don't want to acknowledge that you've made the wrong turn. But it's probably worthwhile to pause, stop, recalibrate, adjust, and think of what your next step is going to be. And that's really the most important advice, I would say.
Totally agree with you. Looking ahead now, how do you envision the future of cardiology in the next decade?
I think it's very exciting. I think there's been a lot of developments in the field of cardiology and of all the fields in medicine. I think cardiology, interventional cardiology, tends to grow and expand very quickly. So it is an exciting time. And I think we just have to embrace change and be happy to accept change. I see the biggest change happening in how we educate younger generations, how we educate ourselves, how we acquire new cath lab skills. I think we're going to start seeing less and less textbook style, module style learning, and a lot more simulation, 3D printing, modeling, and so on, to help us kind of develop our basic skills before we actually jump into the cath lab and take responsibility of patient procedures.
To wrap up, what book would you recommend to our audience?
I really like a book called The 7 Habits of Highly Effective People. I think it really teaches you that you can be ambitious, you can be organized, but there are other ways to be efficient, and it'll help you tailor your own efficiency protocol, so to speak. So I would really highly recommend it for anyone who, whether they're looking for administrative and leading roles or not, just in life in general. It's really good to read that kind of a book.
I've also enjoyed a lot that book. Mirvat, a heartfelt thank you for sharing your valuable insights and expertise. To our listeners, stay connected on the app for our weekly picks of the latest and most relevant papers in cardiovascular medicine, diabetes, and obesity, and see you on the next leg of the Career Boost journey. Thank you.
Thank you, Ricardo.